What is preimplantation genetic diagnosis, PGD, for cystic fibrosis? Imagine being able to see inside an embryo before it even implants in the womb. That's what preimplantation genetic diagnosis, or PGD, offers for couples at risk of passing on cystic fibrosis. This advanced technique is used alongside in vitro fertilization to help identify embryos that do not carry the genetic mutations responsible for cystic fibrosis. Since cystic fibrosis is a serious inherited disorder affecting the lungs, pancreas, and other organs, many couples want to reduce the chance of passing it on to their children. PGD makes this possible by testing the embryos early in the process. Cystic fibrosis is caused by mutations in the CFTR gene, which is inherited in an autosomal recessive pattern. This means both parents must carry a mutation for their child to be at risk. During PGD, eggs are fertilized outside the body through IVF. Once fertilization occurs, a small number of cells are taken from the developing embryo, usually on day 3 or 5 or 6 after fertilization. These cells are then tested for CFTR gene mutations using techniques like polymerase chain reaction, which can detect specific genetic changes. Only embryos that do not have the mutations are selected for transfer into the uterus, helping to reduce the risk of passing on cystic fibrosis. The process involves several steps. First, IVF creates multiple embryos in the lab. Then, a tiny sample of cells is taken from each embryo at either the cleavage stage or the blastocyst stage. The cells are analyzed for CF mutations, and the healthiest, unaffected embryos are chosen for implantation. This approach can help couples avoid the difficult decisions that sometimes come with prenatal testing, such as pregnancy termination if the fetus is affected. Using PGD for cystic fibrosis offers many benefits. It allows couples who are carriers to have a better chance of having a healthy baby without passing on the disease. It also reduces the emotional and physical stress associated with invasive prenatal tests and the possibility of termination. For many, this technology provides hope and peace of mind when planning a family. However, PGD does involve IVF, which requires ovarian stimulation and egg retrieval, procedures that can have side effects. The biopsy process, although refined, may slightly affect embryo development, but advances like blastocyst stage biopsy help minimize these risks. Success rates depend on factors such as the woman's age and the quality of the embryos. It's important to work closely with fertility and genetic specialists to understand the potential benefits and limitations of PGD based on individual circumstances. From the perspective of living with cystic fibrosis and considering pregnancy, PGD offers a way to make informed reproductive choices. It supports the goal of having a healthy child while managing the genetic risks associated with CF. This technology aligns with current medical guidelines and is considered a safe and effective option for many couples. Still, each situation is unique, and consulting with healthcare professionals is essential to determine if PGD is right for you. Remember, advances in reproductive medicine continue to improve, giving hope to many families affected by cystic fibrosis.